We are going to be recording today's webinar, so you'll be able to share that. We're also going to share with you the slides afterwards, so don't worry about that. Please do use the chat to ask questions. I know lots of you will have used Zoom many times before, so you'll be familiar. Do use the chat. We've also got the Q&A function as well, where you can ask specific questions to the panel. We will be having questions at the end of the session. My wonderful colleagues Genshin and Samir will be posting links in the chat as well. So if you'd like to download and access the full report, we'll be posting links throughout today's session. All right, let's get started. Wonderful to see so many of you here today. Today's about introducing you to this new report, Without Access to Justice, the Work and Welfare Problems Driving Food Insecurity. I'm Naomi, I lead Feeding Liverpool. We're the Cities of Liverpool's Food Alliance. We connect organisations across the city who are passionate about good food for all. We're delighted to be co-launching this report with the University of Liverpool, and my co-author, Professor Lydia Hayes, will be introducing the report in just a moment. This is actually the third in a series of events we've been doing about this new report. And we're really enjoying sharing both the report, but also the powerful stories that come with it. We did an event last week in Liverpool, which brought people together in person and began some conversations about the recommendations. Lydia also attended an event at Parliament last night, which was a great opportunity to talk to some of the MPs and civil servants and engage with them around the report at a Food and Work Network event. So really excited to have 3 opportunities to introduce and present this report. Today, we really hope that this is not just an event where you'll learn about the report, but also is the opportunity to start conversations. We've got lots of different groups who have joined us throughout the 3 events. We've got representatives from trade unions, local authorities, the faith and voluntary sector, health professionals, food networks, academics, politicians, civil servants, and advice services. So lots of different people joining today's event and the previous events. Our real hope is that it will bring you together. So today we can form some new coalitions for change. We can have conversations together. We can create a louder voice about the things that need to change in society and build a strong evidence base together. We really hope today's event will be a starting point for this. To briefly run through the structure, Lydia and I are going to start by sharing a bit about the report. We're going to share some of the stories within it. We'll also then we'll hear some reflections from our wonderful panelists. We've got 4 panelists here today. We hope there'll be real conversation starters for you, like I mentioned. After that, we're hoping to have opportunities for you to ask both the report authors, but also the panelists, a few questions, as together we think how we can take some of the recommendations forward. I'm going to pass over to Lydia, who's going to start, and she's going to kick off by introducing all about this report.
Thank you very much, Naomi, and lovely to be here and to have this opportunity to talk about the report. So I want to start with a big thank you to the food support spaces and the final year students at Liverpool Law School, who really made this report possible, created the circumstances in which we were able to gather stories and to sit down together, Naomi and myself, with food pantry leads, visiting spaces, talking to food support space users and volunteers, and to create this report based on those stories. So thank you to all of those support spaces that took the students and to the students themselves for the work that they did. So I want to start at the beginning, start at the end, I suppose, with just praising the findings of our report. So we found that some people who were accessing food support spaces were trying to get by on an income that's below the minimum level promised in law. That accessing legal rights is excessively and often unnecessarily complicated. That the substance of employment and welfare rights is insufficient to protect people from food insecurity. It doesn't provide them with an adequate income. and that a lack of access to justice and this issue of the inadequate substance of rights is a driver for poor mental and physical health. Now, for many of the people on this call, those findings are not going to come as a surprise. We know that food insecurity is growing. We know that wages are far too low. We know that the value of welfare support has been dropping over the last decade, and that people, particularly those families with young people, don't have enough to provide a decent quality of life. We know that workers don't have sufficient voice and influence over their pay, terms, and conditions. But what we don't often see, I think, is that these problems boil down to people being without access to justice. That's the title of our report. And that tackling poverty, hunger, and exploitation requires raising awareness of how to frame these issues as injustice and how to connect the issues together so that we see, for example, the epidemic of stress-related mental health conditions and nutrition-related illnesses like diabetes and heart conditions as arising from a social and economic environment in which growing numbers of people in the UK are without access to justice. Now, what do I mean by that? Samia, could you move on to the next slide, please? So we've taken an approach of looking at the United Nations International Covenant on Economic, Social and Cultural Rights. And we see there that justice requires that everyone can enjoy just and favourable conditions of work, fair wages, equal remuneration, a decent living, safe and healthy working conditions. And they go hand in hand with the right for everyone to be free from hunger and to have access to adequate food, clothing, housing, an adequate standard of living, access to social security, the right for families to be assisted and supported, especially families with children. And these are all rights that are set out in the International Covenant on Economic, Social and Cultural Rights. And as we'll see as we go through our findings, these are the requirements of justice, which are evading far too many people in the UK because of inadequacies in access to justice and the substance of law. So we're going to move to play an animation now based on one of the stories that we gathered from a guy who was using a food support space called Lewis. It's one of many that were gathered by final year law students who were placed in the food support spaces as part of the law degree module that they study.
I work part-time at a restaurant. Before the cost of living crisis, I was doing 4 nights a week, 28 hours. But I'm on one of those 0-hour contracts, and with less people coming in, my hours have been cut. I don't know if I get the minimum wage, I don't get pay slips, and I don't want to ask, because what if my hours get cut even more? I'm a single dad, I've got 2 kids. They're great. Lily May, she's at school now. But Connor, the baby, he's still with me. Childcare's too steep, so I stay with him in the day. My mum has them at nights when I get a shift. I'm looking for another job, but it's got to fit around school hours. It's making me stressed, depressed even. I wasn't eating much, and I've got to feed the kids first. So I go to the food pantry. It's helped. I don't feel hungry all the time.
So as this story of Lewis shows so clearly, workers are earning too little to be able to eat properly, and they aren't always accessing their entitlements. Lewis is being exploited. He isn't getting what he's entitled to. And we know that because he isn't getting a pay slip. And although that's a breach of his rights in itself, it also means it's much more likely that he isn't being paid national minimum wage, but he feels he can't do much about it because he's vulnerable. He's a single parent. That makes him more vulnerable to being exploited because he can't risk losing even more hours. He's claiming benefits to support his low earnings, and that adds an additional dimension to his sense of vulnerability because he has to keep working or he fears he may face being sanctioned. He's depressed, understandably, and it could well be that he experiences ongoing mental health problems. So he may well have a disability because of the acute mental stress that he's been under. And he's also a local resident using a food pantry for support. So the story reveals these different aspects of his life and identity as a low-wage worker in a restaurant, a single parent of young children, as someone who feels stuck, as a guy who's hungry. And thank goodness he had the food pantry to turn to, but the food pantry in no way can fix all of these problems. But it is a space where he and workers like him feel supported and welcome. And there are record numbers of people like Lewis, working people, coming to food banks and food pantries. There are also record numbers now of workers like Lewis who are on 0 hours and insecure contracts. There are record numbers of working age people with illness and disability. And as our report shows, these factors are connected: food injustice, poor quality work, universal credit support that doesn't provide sufficient income to make up for the inadequacy of wages, lack of suitable childcare. It's a lethal concoction and it is leading to people becoming ill. Now, before I move on to our next finding, I want to say a little bit about how this report came about. So, Samia, can I have the next slide, please? Final year law students were placed in food support spaces to put their knowledge of minimum wage law and rights to in-work benefits into practice. So they were giving help and basic legal advice and signposting on to more expert support for those people who needed more assistance and time spending with them. The students also sat with people in food support spaces, working with them to write these individual vignettes about why they were in situations of food insecurity. And so these stories provide a picture of the growing problem of in-work poverty in Liverpool. The stories of workers like Lewis are very timely, and they show how contemporary work and welfare policy is shaping day-to-day life for workers on low wages. And it's about a year since I first met Naomi and the team at Feeding Liverpool, and we worked together to run a training event for food pantry leads and volunteers about the changing welfare system, post-pandemic welfare reforms and record numbers of people in insecure work, and why this was an issue for the food pantry sector. And as a professor of labour rights at the university, I know a fair bit about individual employment rights and why they aren't delivering the protections that people need. But my knowledge was pretty sketchy about what happens when those same low-waged workers claim universal credit. And I didn't know much about food banks and food pantries and why people were using them. And when I met people from the food support sector, people who gave welfare benefits advice, they weren't too confident about what they knew around workers and employment rights. And they weren't tending to have conversations with people in food support spaces about problems at work or focus on how well terms and conditions met people's needs as workers. What we found in our research in talking to people using food support spaces was that working people were increasingly experiencing food insecurity because of this range of work and welfare issues, which are matters of justice. What we also did was about partnering with local communities as a university, working with Feed in Liverpool, embedding our scholarship within the local community. What we did received really positive feedback from the placement providers who identified that the students had been able to provide meaningful help and advice to many people within those food support spaces. And I know from what the students fed back to me that this was a really significant and important eye-opening educational experience for them as lawyers of the future. So that's how this report came about. Can I have the next slide, please, Samia? So I want to move on to our second finding, which is that accessing legal rights is excessively and often unnecessarily complicated. And this is Peter's story. He lost his business when things didn't pick up after the pandemic. But it wasn't losing his business, which was the reason why he was using the food pantry. He was using the food pantry because he had to take a low-paid job and he had waited months before he was entitled to universal credit. He was working full-time, as many hours as he could get, but he still didn't have enough money for food and rent. His children had lost their access to free school meals, so he was worrying about paying for their lunches. And he couldn't quite comprehend that his money really could be so tight. And he was on a waiting list for legal advice to see if there was anything else that could be done. Now, there are significant structural problems with universal credit, especially the 5-week wait. But accessing benefits on top of that, it's also not a straightforward process. Entitlements can be highly complex. They depend upon having all the right information at your fingertips, knowing what questions are being asked for what purposes. And if you're doing it yourself, you need to be able to use a computer. You need to have access to a computer. You need high levels of literacy. Our law students were astonished at how complicated it was to fill out forms or to use benefit calculators, to know which employment rights workers were entitled to and whether their rights were respected, let alone how to navigate through making a claim for a breach of law. And in some food support spaces, people were coming in with bundles of correspondence for students to look at together with them because they had been completely overwhelmed by the complexity of a variety of different systems through which they claim all the rights that they are entitled to as citizens. The overwhelming picture was that in a post-pandemic situation, the work and welfare system is designed to manage people in and out of poor quality work, and it's not sufficiently accessible and inclusive. It's experienced as being threatening, overly bureaucratic, unnecessarily complex, unintelligible, too technical, and it positions people within what is a legal landscape of rules and qualifications without resourcing the legal advice, support and signposting that workers need as a consequence. And I'm now going to hand over to Naomi to overview the other two aspects of our findings.
Thank you, Lydia. Next slide, please, Samir. Thank you. For many of the working age people in our study, we found that even if they had their full employment rights and could access these, and they had their full welfare entitlements, at times their income from both work and welfare provision was still not enough to make ends meet. I want to introduce you briefly to three of the people who we spoke to as part of this work. Firstly, you've got William on the screen. William works over 40 hours a week as a security guard. He's been working long hours. He's what you call surviving, but he's certainly not thriving. He's unable to afford extra clothes or trips, and he's worried about providing for his baby daughter. He's certainly not having that healthy standard of living that Sir Michael Marmot calls for in his health inequalities work. When you add debt repayments into the mix, as William has, but families like William's, we found, are really thrown into very precarious situations. They're unable to afford enough food for everyone in the household. Often they're reducing how much food the adults are eating, perhaps the quantity of food or certainly the quality of food, and for many are skipping meals. We also spoke to Georgia. So if I could have the next story, please, Samir. Thank you. We also spoke to Georgia. Georgia's a single parent. She works 16 hours a week and she receives universal credit. Georgia's someone who's working 16 hours a week to try to fit work around school hours. But she's also trying to avoid what's called the benefits cap. She sits just above that free school meal threshold. Her income is what we've got described as too high for support, but too low to afford the essentials her and her son needs. Georgia says, I have no other choice but to send my son to school with worn shoes. It's an unpleasant situation. Georgia, like so many other people in low-waged work, has been particularly hard hit by the rising costs of living in the last few years. Her wages haven't kept up, and she's experiencing the acute anxiety of food insecurity. Last week in Liverpool and in some other parts of the country, we had schools closed due to the snow. Now, many of us on this call will have enjoyed playing in the snow, but what happened, it really highlighted the particular challenges for many workers in low-paid, insecure job with little stability or control over their hours. Many of them, many parents, still had to go to work that day, despite schools being closed and children being at home. They had to either go to work or risk a loss of earnings. They weren't able to benefit from those flexible family working policies or rights to carers or dependency leave that many people in other types of employment do benefit from. As the stories have shown with Georgia and William, this has left their childcare situations quite precarious. It also causes an immense amount of stress for them as they try to work out how to fit childcare around employment. In our report, we report that it's highly problematic that workers such as Georgia or William, people who are claiming universal credit, can face the threat of benefit sanctions if they don't accept any offer of insecure or 0 hours employment, whether or not it fits around their other responsibilities in life. In our third story, we have Arnold. Arnold used to be a PE teacher. He was injured and needed to claim disability benefits whilst he recovered. When he was able to return to work, Arnold found the pressure to find work overwhelming. He took several 0 hours jobs, but the money was irregular and wasn't enough to pay for childcare. Arnold shared how the stress of trying to cope put pressure on his mental health, meaning he's now off work again and claiming disability allowance, but this time for his mental health. Each of these three people, William, Arnold, and Georgia, are in work. They're juggling the interactions between welfare, the childcare, and the benefit systems. But as the Broken Plate report from the Food Foundation shows, with healthy food costing twice per calorie in consumption in comparison to unhealthy food, families such as these are without the disposable income to ensure their families can eat well and to ensure they can eat good food. As we move on to our final finding, and we begin to think how each of us can respond to these stories we've heard, I want to share Jean's story. This is one of the ones we've made into an animation. I'd love to encourage you to share this story beyond this with colleagues and others as you discuss what you've heard today.
These last few years, they've been hard for us. I've got a job at least. It's just 10 hours a week though. I've been looking for more hours, but I have my granddaughter 5 days a week. I get universal credit and those personal independence payments because I've been struggling with my mental health, but it's not enough. A lot of my anxiety is caused by worrying where I'll get money for food each week. The bills just keep on coming. It's a constant stress. This year I've made some serious cutbacks to my food shops. It's even affected Harry, my dog, as he can't afford the food he likes anymore. He started to get sick. I come each week to the food pantry. It helps take the pressure off. But things are still tight.
As Lydia mentioned, many of these stories won't be new to lots of you on this call. They point to the multiple broken systems of work, welfare and childcare, but also to how these systems interact with each other and cumulatively pile injustice on top of injustice. One of the people I interviewed a few years ago described poverty as like playing with weighted dice that were never in your favour. Throughout today's stories, poor mental and physical health has featured really heavily. As Jean shared, much of her anxiety has been caused by worrying about where money for food will come from each week. Every time she gets a bill, it causes her a lot of stress. She's constantly juggling. In Liverpool, where the stories were gathered and where Lydia and I are based, life expectancy is 15 years less in some of the poorer parts of the city than in the more affluent, with inequalities set to get worse in the years ahead. Today's stories speak to this. Low-waged workers have the highest exposures to workplace hazards, job-related stress, exploitation, and low senses of job control, and therefore high senses of insecurity. Each is an established factor for poor mental and physical health. Whilst many of the people are not earning enough to afford adequate qualities of food, as I mentioned earlier, we also know that the conditions around work, particularly around working really long hours, sometimes late into the night, mean that many workers often don't have the time or the energy to cook from scratch, meaning they're more likely to be eating less healthy food. These effects are all well known and well documented, but what we're seeing here is the interactions between poor working conditions, food insecurity, and poor mental and physical health that are rarely accounted for within policy making, where people's problems or people's lives are frequently siloed into one system or another, with the makeup of people's lives and their whole well-being rarely considered as a whole by policymakers. As authors, Lydia and I had to make a few deliberate choices when pulling this material together. Firstly, we decided to centre this material around people's stories, their whole stories in some ways, the complexity and intricacies of their lives that present them not just neatly slotted into one category as a food bank user or a category as a cleaner or a grandmother. We wanted to show how these things intersect and work together. We also wanted to present some quite far and wide-ranging recommendations, in part to draw all of you into this conversation and to break down the different sectors so together we can build new coalitions. I'm going to hand back to Lydia, who's going to focus on a few of the recommendations before we hear from the panellists.
Thank you, Naomi. Yeah, we're in an election year, and political discussion and commentary often encourages us to think that hard-working people and people using food banks, in inverted commas, are different groups of people, or that people who are working in order to provide for their family are different from those who are claiming universal credit, housing benefit, or disability benefit. Yet there is no difference. And we need to respond to this and these issues in a way that recognises the interconnectedness of welfare, work and health issues. So we've made recommendations that address some of what we think are the key and most important issues: national government, DWP, local authorities, employers, trade unions, universities, food support spaces and food networks. So I just want to run through a few of these that have arisen from the data that we've gathered for the report. So at national government level, the minimum wage needs to be revised to ensure that nobody is working for less than the real living wage. And we need to recall that earning at the level of real living wage does mean that for families that they're still within the benefit system, still requiring universal credit to support their earnings, but at a minimum, the minimum wage should be no less than the real living wage. We also say that universal credit should be generous enough to provide an adequate standard of living, supporting work that is being done by the Joseph Rowntree Foundation and the Trussell Trust for the introduction of an essentials guarantee, which would be embedded within the welfare system to mean that, as a minimum, universal credit must protect people from going without the essentials. We also want to see at national government level the promotion of collective bargaining between trade unions and employers. This is incredibly important. People need a stronger voice at work and more influence over their terms and conditions of work. The minimum wage, the real living wage, it's not enough on its own. People need to be able to bargain with their employers to address also issues to do with really low productivity within our economy and within workplaces. And it would end our reliance on a national system of individual employment rights that can't be effectively enforced by workers like Lewis, who are vulnerable and are not being protected from food insecurity. We want to see investment in free school meals for all, get that issue really firmly on the national agenda and the political agenda, and to support the work of those who are campaigning for that so fiercely at the moment. Investing in free school meals would enable people who live in families with low income to be able to access healthy, nutritious food without stigma. We also want to see an end to the 5-week wait for universal credit, which is purposefully exposing people to a period without money, which is driving debt issues, as Naomi highlighted, and hurting them mentally and physically. We want to see and support all the work that's going on around the right to work framework, which is a campaign to create legal protections to ensure that future government policies don't continue to pull people into poverty. And of course, to end the use of sanctions, because the state should not be using hunger as a punishment. In relation to the Department of Work and Pensions, we'd like to see people with experience of poverty included in the design of policy and procedure that affects them, in order to ensure that people who are in situations of poverty, low-wage workers, are better able to navigate their systems, and that it attends to the realities of people being intimidated, frightened, or put off by over-reliance, for example, on IT as a means of communication, and that lack of face-to-face contact that people need. To make all welfare and employment-related forms and communications accessible to everyone, and to co-design those systems and processes with people experiencing food insecurity. The automatic registration for welfare benefits, reforming universal credit so that people are not having to separately apply for schemes like Healthy Start and free school meals. Because at the moment, there are far too many vulnerable people who are unaware of or unable to access those schemes. We'd like to see the DWP reduce the waiting times for personal independence payments, and crucially, stop requiring benefit claimants to take up jobs on 0 hours contracts, because pushing people into insecure work is detrimental for their mental health, and it's also suppressing wages. At a local authority level, we'd like to see local authorities play a more active role in educating businesses within their areas about the importance of good quality work for supporting mental and physical health, because it's not all about income and wages. So for local authorities to assist local businesses and provide advice to them about how to create job opportunities that are more supportive, more secure, more promoting of physical and mental health, and protecting workers from the risk of food insecurity. We'd like to see local authorities looking to find innovative ways to help workers to realise their individual employment rights, looking at the tools at their disposal through which workers can more easily access and realise, for example, the minimum wage, paid holiday entitlements, pay slips, the right to join a trade union, the right to be represented at work by a trade union. And also, crucially, funding and assistance to the free legal advice sector, this is a really significant and important and worthwhile investment for the maximisation of household incomes and for protecting health. For employers and trade unions, we'd like to see them working together to ensure jobs offer sufficient wages and stability of hours, but for issues of food security to be on the bargaining table, because poor quality jobs that are creating these situations of food insecurity have a really detrimental effect on quality of life. To stop the use of 0 hours contracts, which create extreme insecurity. To encourage employers to recognise trade unions and be open to negotiating changes to terms and conditions that are positive for mental and physical health, giving workers that significant and important opportunity for collective representation. And for trade unions to be supporting volunteers in food support spaces to play an active role in increasing awareness of employment rights. Universities, we'd like to see more universities reaching out to food support spaces and food networks within the communities where those universities exist, fostering new relationships, exploring collaboration, finding ways to promote education, to raise awareness about legal rights among young people, among food support space users, among volunteers and food pantry leads, to be undertaking research in partnership with people experiencing food insecurity, to developing support mechanisms to stimulate political engagement around issues of welfare and employment rights. And for food support spaces to open up those conversations and to reach out and to work with trade unions, employers and universities to really maximise and realise the enormous possibilities that there are for food support spaces to be places for community mobilisation and action, and for continuing their really important work and the support that they offer. So that's an overview of the wide range of recommendations that we've made from the report.
Thank you, Lydia. Thank you for that. We will be posting a link in the chat so you can read a little bit more about those recommendations, but also read the full report. We'd love you to engage with it if you were interested to. If you could start thinking about some questions you might have, either about the material within the report, or we're going to hear from some panelists in a minute as that comes up, please do pop those questions in the chat and we'll get a time to ask them in a minute. We have 4 wonderful panelists with us who have been asked to each give short, focused reflections in response to the report or to one of the recommendations in the report. Our hope in bringing these panelists together is that will inspire you who are listening to think about how you and your organisation can respond, how we can work together. We're going to start with Lord John Hendy. He's a KC, so from the King's Council. We're really delighted to have him here. John is a top barrister. He's represented the trade unionists and many marginalised workers in the highest courts of the land. Most recently, he's been representing Deliveroo riders. That was last year in the Supreme Court. So John, we'd love for you to share some thoughts and encourage some of the others on this call about how we can respond and take some of this further.
Thank you very much for that introduction, and thank you so much for your brilliant multifaceted report and its recommendations. Discussion like this wouldn't be complete without a reference to Karl Marx, so I'll begin with that. One of the things that he pointed out was a particular feature of capitalism, that of alienation. One aspect of alienation is that capitalism alienates us from the people who provide the goods and services on which we rely. There's a division between the consumers and the producers, even though often the consumers are the producers. In contrast, for most of the 150,000 years history of modern humanity, the consumers knew personally all the producers, but now we've lost touch. Trade unions, your campaign, a network like the Food and Work Network, whose meeting I attended last night in Westminster, are an antidote to this. During the pandemic, the workers who grew or caught our food, who processed it, who sold it in shops and supermarkets, and who transported it and delivered it were all hailed as heroes. But now they've receded into the shadows again. That praise and appreciation has had no impact whatsoever on the protection or enhancement of their standards of living. As the Bakers, Food and Allied Workers Union have shown in their recent report, Food Workers on the Breadline, over 60% of their members didn't have wages high enough to cover their basic needs. 88% had reduced their heating and 60% had reduced their food consumption in order to cope. Agricultural workers are the same. I had the honour to represent Unite the Union when we unsuccessfully challenged the abolition of the English Agricultural Wages Board in the European Court of Justice a decade ago. The result has been that agricultural workers lost the benefit of collective bargaining and were reduced to the national minimum wage. As predicted, rural poverty has consequently increased. The other side of the coin is illustrated by the United Nations Global Development Report published at the end of last year and quoted in the Morning Star editorial this morning. It reports this: the last few years of commodity price volatility have coincided with a period of record profit growth by global energy and food traders. In the area of food trading, the 4 companies that conservatively account for about 70% of the global food market share a dramatic rise in profits during 2021 to 2022. That dramatic rise in profits is, of course, matched by the stagnation in the real wages of workers. The value of wages for the vast majority of workers in this country is the same or less than it was in 2008. The equation is quite clear. What is not paid to the workers who produce the food goes to the corporations for whom they ultimately work and is distributed to the shareholders. Of course, it's not just in the food industry that we see the problem. The population of the United Kingdom is about 67 million people. 32 million of them are workers. The Joseph Rowntree Foundation, in its report published this morning, UK Poverty 2024, tells us that 14.4 million people were in poverty in 2021 to 22, and nearly 3.8 million people experienced destitution in 2022, an extraordinary increase of 148% in just over 5 years. This includes 1 million children in destitution, nearly 3 times as many as in 2017. Poverty, of course, means less than 60% of median household income. That's less than the median income from wages, which is about £29,500 per annum. Destitution means less than what is necessary to stay warm, dry, clean, and fed. In October 2023, about 2.8 million households were arrears in household bills or behind on lending repayments. 4.2 million households were going without essentials, and 3.4 million households reported not having enough money for food. This is the cost of living crisis. 2/3 of working age adults in poverty live in a household where someone is in work. More people in work are reliant on benefits than those not in work. The consequences are well documented in your report, and in terms of misery, hopelessness, mental and physical ill health, homelessness, diminished life expectancy, increased perinatal mortality, damage to children's education, increase in crime and antisocial behaviour, and so on. The question is, how is this crisis to be resolved? clearly Britain needs a wage increase. As your report shows, benefit increases, not just the removal of the two-child rule, are essential. So is an increase in national minimum wage to the level of the national living wage. But these are insufficient by themselves. The essential problem is our low wage economy. In particular, increasing the national minimum wage is far from a complete solution. Firstly, it's only an hourly rate. It's not a wage, as in many other European countries. The part-time worker and the 0 hours worker benefits only marginally. Secondly, but very importantly, as Lydia has pointed out, the setting of the national minimum wage does not involve workers. This is an issue of democracy. You might note that the EU has introduced a directive on national adequate wages, which requires, as part of that, that member states produce action plans leading to at least 80% collective bargaining coverage. And that leads me to another demand touched on in your report and mentioned by Lydia. Time does not permit a full explanation now, but the graph of the growth of poverty over the last 45 years is a mirror image of the decline in collective bargaining over that same time span. The 1970s was the most equal decade for income and wealth ever in the United Kingdom. It was also the decade with the highest number of workers covered by a collective agreement. In 1976, 86% of all workers had the benefit of a collective agreement. Now it's less than 25%. That means that 3/4 of our workers, over 23 million, have their terms and conditions set on a take it or leave it basis by employer diktat. This has been achieved by aggressive derecognition policies of government, restrictions on trade union action, privatization, outsourcing, globalization, and so on. This is the policy reversal, which is the most important for Labour to achieve. The re-establishment of sectoral collective bargaining and the removal of the legal restrictions on trade union action. These two objectives are enshrined in Labour's New Deal for Working People, but they must also form an essential part of the campaign for food justice. The battles fought by campaigners and trade unionists are battles in the same war. A coalition, a popular front, is essential for success. Thank you so much for listening.
Thank you, John. Wow. Lots to reflect on, and I know some of the questions are beginning to come in the chat. We're going to hear next from Professor Matt Ashton. Matt is the Director of Public Health at the Liverpool City Council. He's someone we work closely with at Feeding Liverpool and are forever grateful for your support, Matt. Matt's also worked closely with the University of Liverpool and has lots of an academic background himself. He's recently published a new report that's called A State of Health in Our City. Matt, we'd love to hear what you think about the report, but particularly about that fourth finding about the impact on mental and physical health. So over to you, Matt.
Thank you, and thanks for inviting me to speak today. So first of all, congratulations on the report, fabulous report with really powerful case studies in it as well. And also the way the report was compiled was really interesting, really interesting and strong methodology. So well done. The words of Marcus Tullius Cicero come to me often. That's probably not an expression that happens for many people, but Cicero talks about salus populi suprema lex est. If your Latin is as bad as mine was at school, I'll translate that. That basically means the health of the people is the highest law. And I think that's important. Sometimes we have to make the case for why this stuff matters. It's clearly unfair, but why does it matter to society? And I'll come back to that. So as the report highlights, there's a misconception that people who access food banks and community food spaces are not in work. However, there's an increase in people who are in paid employment becoming food insecure and having to access community food spaces in order to feed themselves and their families. And the effect of that will be having on people's physical and mental health is, of course, immense. And as Naomi mentioned, I launched a report last week called State of Health in the City, about Liverpool's health both now and in the year 2040. Now, Liverpool is one of the most deprived areas of the country, it's third most deprived area, but its patterns of health are not dissimilar to other parts of the country. I'm just going to draw out a couple of quick headlines. So, for example, in Liverpool, we live 3.5 fewer years than the England average. We have a shocking 1,900 people dying under the age of 75 every year, and 1,100 of those are entirely preventable. And we have over 90,000 people in the city living with major illness. That's 2 or more long-term conditions. And I think, as Naomi said in the introduction, if you live in the poorest parts of our city, you're likely to live 15 years less compared with someone living in the most affluent areas. And then crucially, because it isn't all about life expectancy, it's about a life lived well. If you live in those poor areas, you will live 18 years longer in poor health. So healthy life expectancy is really low as well. And those figures obviously mask other inequalities in relation to race, gender, age, and disability. At every point in the life course, our residents experience unacceptably poor health outcomes, whether that's the 24,000 children living in poverty, or the 2,355-year-olds who've got tooth decay, or more than 75,000 adults in the city living with depression. And again, it's the poorest areas of our city that experience the greatest burden of that ill health. Now, my report tries to project forward. What will health in the city look like by 2040 if we carry on the current trajectory and if we keep on doing what we're doing right now? And those results are really quite stark and quite worrying. We estimate we would see a fall in life expectancy for women by around 1 year. And that's, an actual drop in life expectancy. And critically, we project that women will live an extra 4 years in poor health. Another social gradient, those numbers, not really a surprise. We estimate there'll be up to an additional 38,000 people living with major illness, 2 or more long-term health conditions. And for each of those people, of course, there's a risk of them needing higher levels of health and social care support, an increase in conditions like diabetes, asthma, kidney disease, cancer, and hypertension, and a predicted doubling of the number of people with depression in the city. And of course, there's a personal cost to each of those individuals and their families in terms of the quality of their daily lives. And we know also from the evidence that poor health in adults can mean more parents are out of work, and this can have a negative impact on children's mental health, on educational attainment, and on school absenteeism. And so the pattern carries on. So why does health matter? So clearly there's a fairness, a justice element to this. It simply isn't right or fair that some people live less years overall or live more of those years in poor health just due to differences in where they're born, what their sex or their ethnicity might be, or their cultural background is, or because of their environment or living conditions. But secondly, the cost of ill health to the NHS and the social care system is huge. So in Liverpool, the estimated current cost for the city's health and social care services is £1.9 billion a year. And don't forget, these are services that are already under huge pressure to deliver high quality care to everybody who needs it. So the more we can reduce the demand for those services, the better those services will be at coping with the people who most need health and social care support. And then finally, there's the impact on the local economy of poor health and well-being. So health and the economy are two sides of the same coin. If you've got a healthy population, the local economy tends to do well. If you have an unhealthy population, the economy can struggle. And we know that 1 in 3 of our economically inactive residents were off because of long-term sickness. So if we truly want to level up the city, we have to address the health challenges the city faces, and that will apply in Liverpool as much as it will apply elsewhere in the country. And the we there is important. I'm trying to make the point that this is everybody's business. to improve health. Everybody has skin in the game. The better health and well-being is, the better our areas will be, the better our populations will be, the better our communities are and are more likely to thrive. So moving on to the actions, the recommendations, and by the way, I really want to just call out one of the recommendations about making sure people are involved in the design of policy. It's so important that people who are most directly impacted by policies have a voice and are able to influence what those policy looks like. You do not want a bunch of, well, I'm going to maybe change my language slightly. You do not want people, civil servants in central London dictating how people are going to live their lives in areas like Leeds, Liverpool, Newcastle or Manchester. That's not right and that's not proper. So people absolutely have to be involved in policy making. But two bits that are crucial, it feels to me, for this particular report is about good employment for all. We absolutely need to make sure that businesses, employers, industry and the different parts of our economy are playing their part in ensuring our employees, our residents, but employees get the wages and the support they need to live their lives properly. Because if they don't, frankly, it impacts on the business. So it's counterintuitive. It makes no sense. And then secondly, the crucial importance of having that right to food, having people able to access the food system properly. Now, I am immensely proud of the work we do with Naomi and the team around Feeding Liverpool. They are a fantastic organization, and you said you were grateful to me. I'm grateful to you for all the fantastic work you do in helping our citizens access good food. But it has to be more than that, and we have big ambitions around a city region food strategy to make sure that it isn't it doesn't depend on where you live or how much money you've got in your pocket as to whether you are able to feed yourself and your family properly. I'll stop there. Thank you.
Thank you, Matt. But we're moving on to Helen next. We're delighted to have Helen Barnard here. Helen's the Director of Policy and Research at the Trussell Trust. The Trussell Trust, as I'm sure many of you know, run the largest network of food banks across the country. Like Feeding Liverpool, the Trussell Trust are really committed to ensuring the voices of people on the ground influence policy and practice. They're leading the Guarantee Your Essentials campaign along with the Joseph Rowntree Foundation, which I'm sure Helen will mention, and we'll get some links in the chat up for how you can get involved with that. Thank you so much, Helen, for coming along. Looking forward to hearing what you have to say. Please do keep using questions in the chat, people, and if you've got specific questions for Matt or John, please do put them there as well.
Hi, really great to be here. Thank you. So when I was reading the report, I was thinking, what are the barriers to achieving some of the changes that clearly need to be made? And there were two that I wanted to pull out. The first one is that there is a almost total lack of either public or policy or political discussion about what the actual role of social security is. And in particular, there is no agreement across society that a core function of social security should be to make sure everyone can at least afford the essentials to protect people from destitution or severe poverty. And that has always been the case. So there has never been any link in our system between the idea that the level you set benefits should have some relation to the actual cost of essentials. So I found it interesting in the report where the language was about people are getting less than their legal minimum income. The thing that I thought is there isn't a legal minimum income. There are benefits that are set year by year according to political winds, fiscal pressures, all these other things. And what it also means is that when we do make progress in getting better social security, which has happened in all sorts of fronts, it is very easy to undo that. And we've seen that in the last 10, 15 years, that successive governments can reduce benefits to incredibly low levels and pay no political price for it, because there is no society-wide buy-in to the idea that social security should achieve certain things, and therefore it is unacceptable to reduce it below a certain level. So for me, what I think that means is we need to have a public and a political conversation around the principle that nobody should be forced into destitution, that everybody should be able to afford the essentials for themselves and not have to rely on charity to meet their essential needs, and that social security should at least be set at a level that delivers that. And that is what many of you will know. The Guarantee Our Essentials campaign is essentially trying to establish that principle. So like many of you, I have spent the last however long decade or two campaigning for very specific changes to social security, and we still do that. But what the realization I came to was that until we have that principle established, we are just fighting lots and lots of fires every budget, every autumn statement. And we need something bigger, we need something overarching, because if we can establish that principle, you then can talk about the fact that the 2-child limit means that one member of the household is not receiving what they need to meet essential needs. You can talk about the fact that the benefit cap reduces people's income below that level. You can argue about debt deductions, not taking people. It is the thing that will open the door to a lot of the other very specific changes that we need to make. And it is a way of talking about social security that actually gets public buy-in. And that's really hard. Again, many of you will know this. Getting the public to support social security changes, positive ones, is really, really hard. But when you talk about it in that terms of it's about people affording essentials, it sounds like common sense. And you get an amazing degree of consensus across the political spectrum, voters of different political persuasions, for that principle. So that's one thing. The second thing is I was thinking about the work piece and about employment rights. And the thing I always think is we are so bad in the UK at enforcing the rights we already have. And those of us who work on labour markets and are improving work, if you look at the amount of time we spend arguing about how you get new rights for people and the amount of time we spend talking about how you enforce existing rights, I don't think that we collectively have got that balance right. So at the moment, enforcement is split between at least 3 bodies of different of rights. And it basically relies on either workers or someone else reporting infringements or challenging their employers. It relies on individuals challenging. And alongside that, the UK has less than half the number of labour market inspectors that the International Labour Organization says you need for our population. And what that means is proactive enforcement, proactive investigation is incredibly difficult. And the result is that many workers are poorly treated. We've been hearing about that today. More than 400,000 don't even get the legal minimum wage. So the kind of very unshiny, unsexy policy recommendation that I would like us to be pushing is, let's have a single enforcement body that enforces labour rights. Let's increase the number of inspectors we have. Let's resource it to actually enforce rights and not rely on the most powerless workers in our labour market to be leading the charge on enforcing rights. And that's the last thing I think that I was reflecting on, that when we talk about poverty or food insecurity, we very rarely talk about power, even though being powerless, feeling powerless, is such a central part of the experience of poverty. I remember hearing one person say that privilege is the ability to avoid discomfort. And if you look around you, who has the ability to either buy their way or argue their way to avoid discomfort of different kinds? And when you think about people in poverty, you kind of think about people who live in social housing whose landlords completely ignore their pleas to fix the roof or get rid of vermin, or private renters who are too scared even to ask for dangerous wiring to be fixed. They do not have the power in the housing market to walk away and say, fine, I'll get myself somewhere better to live. You see that in the labour market. And we heard that from one of your examples, worker who says, I'm not even going to ask to be paid the right wage or get shifts because I don't have the power to enforce that, and my employer can quite easily just drop me. Similarly, I think about disabled people. So a lot of the people who come to food banks are disabled. Many of them don't get disability benefits, and one of the things that our advisors will help them do is go through the PIP process and so on. But disabled people who are going through really quite traumatic, often, benefit assessment processes, they can't demand to be treated with dignity. Again, they can't walk away. because they can't survive without those benefits. They don't have the economic or social power to demand rights. You see that again with people on universal credit who have debt deductions set, which they know they can't afford, but they don't argue with the work coach because the power imbalance there means you're not going to argue with that person who holds the ability to whether you're going to be able to pay the bills and feed your kids. So I think a lot of what we're talking about today are the ways in which we can start to correct those power imbalances. So as we heard, unions are all about that, about workers who individually don't have the power, banding together to have the power. Having independent advice is another way you boost the power of the people who don't have it. But I also think building public support for some core commitments we can make to each other, like social security, there when times are tough, it will cover the essentials. Like we believe that workers should be treated fairly. That invisible but vital public support is one of the ways we create the conditions for people who are currently powerless to be able to access the rights which people who have more economic or social power, in a sense, can grasp for themselves. So I suppose that's what I'd urge to think about. What are our mechanisms to correct these imbalances of power? And who do we need on side to do that? And that is going to need what I think of as a big tent approach. We need to bring as many people as possible on board with this and use language that will engage people so we can get that broad-based support. I'll stop there because I know we want to have time for questions, but thank you very much.
Thank you, Helen. And one of the things that came out of last week's event in Liverpool was, as a food alliance, Feeding Liverpool, how we could work much more closely with the trade unions, who we have lots of shared aims, but we could be equipped and support each other together and build that power that you were talking about. That moves us on really nicely to our final panelist. Delighted to have Andrew Forsey here. Andrew's the director of Feeding Britain. Feeding Britain evolved out of an all-party parliamentary inquiry into ending the need for hunger back in 2015. They now support over 90 food alliances, of which Feeding Liverpool and many of you on the call are one. They seek to work with politicians and civil servants to address the real root causes of poverty. So delighted to have Andrew here today. Thanks, Andrew.
Thank you very much, Naomi. Well, we are almost certain to enter into a general election campaign later this year. And for the first time, really, since the emergence and subsequent growth of the food bank movement in this country over these past 10 to 15 years or so, we'll be going into that campaign with the leadership of all three of the largest parties in the House of Commons having gone on record at some point to say that they wish to see a significant reduction in the need for food banks. But what's been missing so far is a detailed plan of action to back up that sentiment and to back up those words. And that's where I think we owe a huge debt of gratitude to Lydia and Naomi for producing the report we're discussing today, because you are giving all of the political parties the map and the compass that they need to address head-on those drivers of food bank usage that are prevalent both within the Feeding Liverpool network and sadly right the way across the wider Feeding Britain network. Now, one of the things that struck me in the report was the same pinpoint accuracy with which Lydia and Naomi identified both the causes and consequences of insecurity and injustice in Liverpool, as did Eleanor Rathbone in her study of dock labour in the city that was published around 120 years ago. And it was around that time, in the first decade of the 20th century, that a broader campaign was beginning to emerge around this issue of how we could prevent the kind of insecurity and injustice that Eleanor had identified in Liverpool. And that campaign built up a head of steam, thanks largely to the leadership of Sydney and Beatrice Webb. And it's centred upon their idea of a national minimum standard of living, below which nobody in our country should be allowed to fall, underpinned by government policy and legislative change. But Beatrice described this in her diary as a policy to construct a base to society in the form of a legally enforced minimum standard of life. And looking back to that period, William Beveridge noted that on the side of income, the early applications of this idea were made through trade unionism, as we've been discussing, and minimum wage legislation, while the plan of social security embodied in his own report in the early 40s was a later application of the idea of a minimum income, but to times of not working. Now, when you think of the rafts and rafts of legislation and hundreds of policies which gave life to the welfare state, not least on the back of that Beveridge report in the 40s, it really is quite chilling to think that here we are again in 2024, seeing quite clearly in Lydia and Naomi's reports an urgent need for the reconstruction of that national minimum to prevent people falling into the abyss of destitution. But that is where we find ourselves. So looking ahead, I think there are two key reforms that have been put forward just within these past few months by two former prime ministers, which could, I think, help us begin to achieve the reconstruction of that national minimum and to provide that legislative framework for the proposals that Lydia and Naomi have put forward in this report. First, the Tony Blair Institute has recommended what they're calling proactive public services, which make full use of data and technology automatically to register all eligible families for schemes such as Healthy Start and free school meals, which boost their budgets. And secondly, the Commission on the UK's Future, led by Gordon Brown, recommended a new legal duty on the state to ensure, quotes, no person shall be left destitute. And I think this could at the very least prevent the introduction or continuation of policies which actively trigger the need for food banks, like the present regime of benefit sanctions, like those lengthy delays in the processing of disability benefits, and like that high rate of deductions that we see from universal credit. It could also pave the way for a body in the image of the Low Pay Commission to recommend annual benefit rates which genuinely protect people from destitution. And also taken to its logical conclusion, it could likewise give bodies like the Parliamentary and Health Service Ombudsman and those labour market enforcement agencies the remit that they require to operate much more proactively and preemptively to root out and address any potential or actual sources of insecurity and injustice which trigger the need for food banks. And for a bit more detail on that, 5 years ago, Frank Field and I published a report called Legalising the Gig Economy, which set out such a framework there. Just as a quick aside, given that there's quite strong representation from local government and the voluntary sector at this afternoon's meeting, we have piloted up here in Newcastle a scheme whereby a certain number of officers from the local authority are relocated from the civic centre and from the council offices out into food banks and community food spaces for a part of the week, so as to identify much more early in the process examples of where people are being deprived their rights, those existing rights that have already been laid down in law, and to set in hand much more quickly the action required to ensure those rights are in fact being fulfilled, are in fact being delivered, and that we can prevent those prolonged cases of destitution arising. So perhaps something for those of us in local government and the voluntary sector to think about is how we might reorganise, redeploy, restructure our existing staffing and resources to help people realise their rights. So in coming to a close and taking together, and in again borrowing a phrase from Eleanor Rathbone from her report on dock labour in Liverpool, I think taken together we have here the potential outlines of a plan to put into practice the motive of humanity to help us reduce significantly the need for food banks throughout the remainder of this decade. In the meantime, Lydia and Naomi, thank you again for producing this stunningly good report.
Thank you, Andrew, and thank you to Helen and John and Matthew and to Andrew for sharing some really practical ways that those of us can respond and get involved with these recommendations, but also quite challenging thoughts about how the different sectors and communities could be working together. We have had a few questions come through, and please do post any more in the chat. I wanted to start with Cosie's question. Cosie works at Citizens Advice Liverpool. She said, great recommendations, but how do we get them implemented? She specifically asked, what can individuals and organisations do to work towards that end? While I give some of you on the panel a moment to think about it, I was jotting a few things down for Cosie and for others who are thinking, great, but what can I do? Obviously, we've mentioned quite a few national campaigns throughout this this presentation. We've mentioned the No Child Left Behind campaign around free school meals. It's something we support at Feeding Liverpool. There's been lots of practical ways you can get involved with that, including writing to MPs, sharing stories about the difference free school meals would make, but we will post those links. I've also posted a little bit about the Fawn Network, which is the Food and Work Network. It's particularly for activists, academics and trade unionists. It's becoming a space where we can gather and kind of bring our voices together. But as an individual, one thing that is important to do is shop and use businesses that pay the real living wage. We don't want to be complicit in those low earnings where people are earning below the minimum wage or below the real living wage. So really think carefully about where you choose to spend your money, in the hope that we can kind of influence mindsets slowly that way. I loved what Helen said about sharing stories and the importance to get public to shift their mindsets, and using language very carefully around that. So there'll be things as individuals we can do. So big national campaigns we can support, smaller ways that can hopefully slowly have a ripple of change. At Feeding Liverpool, we're going to work more closely with our trade unionists, and we're going to be hosting some meals and inviting them to them and starting off conversations about how we can work closely together with them. Lydia, did you want to come through with a few practical suggestions about how individuals and organisations can really get involved in implementing the recommendations?
Yeah, I think that we need to expect more. We need to keep making demands on politicians, particularly during this year and at this particular time. There are, such a multifaceted areas of crisis, and it's hard, but we need to resist this siloing into different issues. As Helen was saying, talking more about the importance of the social security net, what it's actually there for, the importance of promoting essentials. For me, what's really important is that we start bringing employers and trade unions into these conversations around health and around poverty and around disability and around income support, because they are all so interconnected. And we need really big changes. And those changes are matters of political will, and they are also about issues to do with powerlessness, as has been said. So I think that one thing that we can do is to keep connections open, to support one another's campaign, to build and reference one another's work, to see ourselves as connected within this movement, which is around work and income and welfare and health, and to start making those really broad arguments and to use the contacts and networks that we all have individually, and to recognise that we all have expertise in many different areas of these problems, and to share that expertise and to reach out and to educate one another, and to have solidarity in terms of moving things forward.
Thanks, Lydia. Would any of the other panelists like to come in, specifically how individuals or specific organisations can respond? Yeah, Matt. To you first.
At risk of repeating what others said, however, I think we need to walk the walk, not just talk the talk. So we have an individual responsibility here that we need to occupy. And I think we need to tell people that stories are very powerful. So how you get that story about how we are as a community behaving, and our expectations point from Lydia is really powerful. You know, how we expect or want other people to do similar. And I think hearts and minds here. So this is the bit I tried to say in the talk. You know, we can all get angry about fairness and injustice, but unless people see why it really matters to them personally, people probably won't take action against it. And that's why employers are really, really important in this space. And I think there is something interesting about not working with the usual suspects, working with the employers that tend to present more of a problem or a dilemma, and making the case to them repeatedly, often.
Exactly, Matt. Yeah, really important to draw different people into the conversation and widen our net. I think Helen said that earlier. John, please do come in.
Yeah, thanks very much. I was just going to add to what people have said without undermining or contradicting any of the suggestions that are made, which are all absolutely excellent. But one of the things that's is needed is the recognition, which is obviously happening in this meeting now, of the importance of all these campaigns. And we need to link the campaigns and the unions together in a sort of popular front. I mean, the entire country is united against the against this government and against the manifestations of neoliberalism that we see. But what we're not doing is fighting as a whole. And the battle of the climate change people and the renters and the people on behalf of the disabled and those that are fighting on behalf of food banks and on social security or benefits and so on. All these battles are really just aspects of the same self-defense against the form of capitalism to which we're being subjected. And we really do need to unite around minimum demands and recognize and respect the demands of the other campaigns, even though we personally may not be participants in those campaigns or particularly affected by them. So my plea is for unity and a popular front.
Thanks, John. Helen.
So I had three quick things to say. One is it's an election year. MPs, whatever one might think, MPs genuinely care what their constituents think, and they are swayed by what constituents tell them they care about and what their priorities are. So all the kind of writing to your MP, going to see your MP, organising friends and family to do that is really powerful. The second thing I'd say is I think there is something for those of us who are quite close to these issues, who are really embedded in it. There is always a temptation to talk in ways which appeal to us and people like us. And actually, we need to find ways to reach out beyond that kind of already convinced community. And often that will mean talking in ways that what our most active activists really respond to. So just thinking about who are we trying to persuade and what language will they find persuasive. And that may not be the same as our most natural language. And the other thing I would say is about unity. And in particular, I have strong memories of talking to assorted ministers and so on ahead of budgets, advocating for things and then saying, the problem is when I tell the Treasury you want this, they'll say, yeah, but there are 15 other charities who want different things. If we do your thing, the other 14 will shout at us. So why would we? Why would we get no political capital? So that thing of unity, of trying to come up, which is why the Essentials campaign has been so interesting, because it's got a level of unity I haven't seen before. And that is really useful for our allies and advocates within government, because there are people fighting these corners, but it's really hard for them. So we need to strengthen their hand as far as we can.
Thanks, Helen. Andrew, did you want to come in?
Yeah, thanks, Naomi. Just with 2 points, if I may. Firstly, to draw attention to Kathy's really helpful comment in the chat about the willingness of certain Job Centre Plus districts and staff to engage with us. When it brings back a memory on the other side of the Mersey a few years ago, where through the Feeding Birkenhead initiative, we gained the agreement of local job centre staff to reform the claimant commitment, whereby if I was starting a new claim for universal credit, I'd sign that commitment to accept the duties that I need to undertake while claiming with a set of rights. So we produced some literature that was given out alongside the claimant commitment to say, while you are on a low income, here are the rights to which you're entitled. Here are the support schemes that exist that will help you to apply for. So that was done with the engagement between the local food partnership and local job centre staff to rebalance the rights and responsibilities with individual claimants. So Kathy, thank you for drawing our attention to that piece of work. And secondly, Naomi, picking up on your point on the importance of trade unions and what an ideal role could look like for unions in the fight against hunger. It was about 30 or 40 years ago when the food bank movement really began to grow in North America, that the trade unions developed a slightly different initiative, which we would probably characterize as a pantry or a food club, where they opened community rooms, gave working class families a choice of what shopping they would take home for them. There was a financial contribution, but they went beyond food to say, okay, let's assess your income, let's assess your earnings, let's assess the schemes to which you may be entitled, and then let's get you signed up in full to your rights, to those services to which you're entitled. So perhaps that's something we can look at with union branches with sufficient capacity around how they might help us reform community food provision, shifting from food bank to food club. But as importantly, if not even more importantly, how could they provide the wraparound support to ensure people's rights are being fulfilled and delivered?
Thank you, Andrew. Andrew, are you able to quickly answer one of the other questions in the chat? It was, are there plans to lobby the government around their plans to change universal credit and remove the work capability assessment? And are there things people on the ground can do to support that? Is that something Feeding Britain is going to be involved with going forward?
Certainly, and particularly if we start to get wind across those 90 odd regional partnerships, Naomi, that this could, if not handled carefully, add to the numbers of people who are hungry, then yes, of course, we would take that forward.
Thanks, Andrew. And we'll put a few more details in our kind of post-event correspondence about how you can connect in with Feeding Britain and some of the other networks we've mentioned today. Conscious we've only got 1 more minute, so we are going to draw this to a close. We will seek to get to Hannah's question in our post-event communication about how we draw different people into the conversation. Been just such a privilege to have all of you panelists here today to join us, but all you attendees as well. And thank you so much for all the questions and insight you've brought throughout the chat, and for listening and all the comments there's been on social media as well. As a next step, my colleague Gentian has been posting in the chat a link to the evaluation survey. That's not just so we can learn about the event and what we can do differently, but also in it there's an opportunity to say if you want to keep being involved further in these conversations. Lydia and I and our organisations would love to keep these discussions, build these coalitions, keep this moving forward. So please do complete that or reply to our post-event communication about staying in touch, about how we can connect some of these conversations, some of these different sectors that we've got here and the sectors that are missing as well. So please do complete that. Please do look out for post-event communication. We really see this as the start of the conversation, hopefully not the end. Where you can share the report with your networks. I put a link in about the YouTube animations we've been showing. They're on YouTube on Feeding Liverpool's channel. If they'd be helpful, do use them in any ways, in any conversations, any events you go to as conversation starters about the reality for workers on the ground. Lydia, I'll leave you with the final word if you'd like to say something to everybody, and then we'll close up for today.
Thanks, Naomi. Yeah, just to echo, great meeting, great contributions, really inspiring. And let's keep, connected and think about ways that we can utilise collectively and mobilise our resources to pursue the objectives that are so important to everybody who is involved today. So yeah, please do share your details and let's keep in touch. Thank you.
Thank you. Thank you, everyone.